Hi everyone, today we are going to discuss an OIT letter for nurses, and this was asked for the real exam in January 2021. I think it was on the same date, 23rd January. Most of my students have written this particular yeah, that I think that was the date. Okay, now this letter is addressed to a music therapist. So it's a quite uncommon letter. So usually you see addressees like doctors or other fellow nurses or physiotherapists, pharmacists, or some medical professionals or social worker you have seen, but this is quite uncommon, a music therapy. So what data you need to include here is a real question. So when we analyze the writing task, you can see that this is a referral letter. So you are going to write, refer the patient to someone. So this is the person. Who is she? This is Miss. So she is a music therapist, and she visits the nursing home. The nursing home you are working, she visits occasional visits are made by this particular lady to the nursing home. So address the letter to Miss Georgina Jolly. The full name is there, music therapist. Music for you, Brisbane, Australia. So all these things are there. We have completed the task. So we understood the task. Now let's go ahead and see what are the things we need for a music therapist. So we need to give some vital information to music therapists. So as usual, we need the patient name and age, and we need the date. Today's date is there. Now, when it comes to social background, so I don't think that is widower, retired bank clerk is important. So I can say he needs a solitary life there. So right now he is staying in the resident nursing home. So this is not important. This is not important. If I say lives alone, that's okay. Drinks regularly. Music therapist doesn't need this information. So if this is not needed, this is automatically, we don't need that thing too. And this is something which she needs to understand from the social background, that is hobbies, music, singing in choir a year ago. So medical history. You are not going to present any medical history that alcoholic dementia, first visit by community nurse, hepatic cirrhosis, and the thiamine. These things we don't need because you are writing to a music therapist. The address is different. So I have selected some of the data from now presenting complaint on admission. So this is this happened on 14 December. The admission date was 14 December 2020, with inability to cope with activities of daily living. Now, he was suffering from this problem, acopia. So you cannot write this particular word in the letter because you are writing to a non-medical professional. So you are writing to a music therapist, and this person has no that much idea about acopia, ataxia, praxia, all these things. Those are medical terminologies which we can write only to medical professionals like doctors or fellow nurses. So to a music therapist, I am not going to write this particular thing. So no terminology is used. So if instead you can write this thing. So the community health nurse, the community nurse encouraged him to get himself admitted in the nursing home, and that's why he got admitted on 14th December 2020. So he was shabby and he was aggressive as reported. This I can summarize this as shabby. I can summarize this as aggressive. Here also he has some behavioral problems. This is having no hygiene is bad behavior. Hitting the co-stair and staying alone is not a good behavior, and rejects care by female staff or ignoring female staff is also something which is not acceptable. So I can summarize. I have a lot of things to summarize here. Now, diagnosis is very important. I have to say that the diagnosis is self-neglect, and the plan is to start the behavioral management program, and music therapy is a part of this behavioral management program. So we have a lot of other programs included. So in that, music therapy is also a part. Now we can say that this is something which we need here, reduce aggression. So I don't need this thing. We can keep in mind, but we don't need these things. The diet is irrelevant. And now to maintain calm from aggression, that's something we need. Now on 21st of December, 1 week later after the admission, so yes, this is very important. I need the summary of this thing. So don't copy these things as it is. So we need to convert it into sentence format. This is what we need here. And when we go ahead with this 23rd, so this was 21 and this is 23rd. We are going in order, 14, then 21 and 23. So we have from 14, he got admitted, and now it's almost more than a month. So 14th December he got admitted, 21st January. So I think that is not 21st January, it is 21st December. So I have to make a change in the case notes. I have written 27. Okay. No, I have not written the date. So no issues there. So I can say that today, 23rd January, he got the aggression, the condition. Today, we can see this is the condition here. So here, what he needs, what the music therapist needs: aggression reduced, visit my word, talking to others, participate in singing around. So eating fruits and vegetables is not needed. And now this is a very important thing that the music therapist needs to know, referred to the music therapist. He gave consent to share his medical history to the music therapist. And that's why we have arranged a session with the music therapist. Now, this is the aim. So that is the purpose of the letter. I'm writing this letter to contact a music therapist. Now let's go ahead with the introduction. So you can say the date. Yes, the addressee, Georgina Jolly, this music therapist. Now, salutation, dear Miss Jolly. It is a semi-formal salutation. So if I write Miss Jolly, if I address the person by name, naturally I have to close it by yours sincerely. And if it is dear sir or dear madam, then here it comes yours faithfully. So the salutation is important. The closing is also important there. So if I write name here, I have to write yours sincerely. If I don't write name, dear sir or dear nurse, if you're writing, then yours faithfully it is. Now reference the patient's full name, age. This letter is to refer full name, his name, who requires regular visits from you to improve his condition. Requires. Okay, so I can make a change who requires your regular visits. So I can, instead of 2 words, I just minimize the word count. This letter is to refer Mr. AARY VANOV, who requires your regular visits to improve his condition. He suffers some behavioral and social problem. So I have made 2 sentences in the purpose. The purpose is very clear. On 14 December, so we are starting from the beginning. On 14 December, Mr. VANOV was admitted to our nursing care. He came to our nurse. Why he came? After being referred by the community health nurse who used to visit him. A community health nurse used to visit him at his home. She found that this person was unkempt and having difficulty in carrying out his routine activities. So that is why he got admitted in the nursing home, and this is as per the request of the community health nurse. He also showed aggression and refused being cared by female staff. So I can say he was hitting the fellow patients. So I have said he also showed aggression and refused being cared by the female staff. After assessment, okay, only after assessment we can go with the diagnosis. He was diagnosed to be suffering from self-neglect and was advised to initiate behavioral therapy to resolve this crisis. So we have a lot of crisis here, behavioral problems there. So behavioral therapy is initiated by his GP. A week later, Miss VANOV was seen listening to opera in the garden but hesitated to participate in group singing. He also preferred to be alone and shouted at his fellow residents. Now, this was the condition after a week of his admission. But today, after this 14 is gone, 21st December is gone, almost a month later today, Mr. VANOV appeared to be calm and happy. I can say however today. So it was the previous sentence was something disappointing, but this particular sentence is something positive. So that's why it's opposite. However, today Mr. VANOV appeared to be calm. So use punctuations very carefully. So we have to be very careful in using the punctuations in OIT. However, today Mr. VANOV appeared to be calm and happy. After a visit by his old male friend, he started communicating with his co-residents. He also participated in group singing. So that is something else there. It was sing alone. So don't copy the words. We need to make some changes. So don't go with the sing alone. What those vocabulary which are used in the case notes, try to be little bit different. So we have said group singing with a good voice. He sang with a good voice. Now, Mr. VANOV used to live alone. This is something we need to give something. we need to bring the attention to towards the music therapist that this fellow was a singer by himself almost a year ago. Until then he was um, a singer, a part of the choir, and this is an additional information. He lives alone. It would be appreciated. So what you have to do, it would be appreciated if you could assess his condition and make positive changes in his behavior. So you have to assess and positive changes in the behavior. You need to and understand. Of not, please not. He agreed to share his medical history with you for therapeutic purposes. So this is something very important here. So it's in the question. Music therapist agreed, gave consent to share medical history. Most of the people won't be seeing this thing and considering this thing as something secondary. So this is a primary thing. We need it very badly. So only after the consent, then only this appointment is made. So we have to write that. Agreed to share his medical history with you for the therapeutic purpose. And if you have any further queries, please do not hesitate to contact me. Yours sincerely, registered nurse. And that is the end of the session.